Hi there, my name is Kylie Coronado and I'm an LPN to BSN nursing student at Indiana State University, and this is a community health education program for nursing 444. So the population at risk that I wanted to focus on are those that are at risk for catching and being exposed to tuberculosis. And given everything that's going on right now in the world with the pandemic of COVID-19 being also an airborne virus that's spread, I thought this would be another one to focus on that many might forget about. So hope you guys enjoy. Now, if you want to take a moment to pause the test, and down in the link below, there is a pre-test that you can take and test your knowledge on what you know about tuberculosis before continuing to watch the video. So some things that I wanted to go over in this video are what is tuberculosis and explain what that is, who is at most risk for tuberculosis, going over some of the symptoms that you might see if you have tuberculosis, the population that I'm focusing on, what makes them at higher risk, and how do you catch tuberculosis. And then at the end, I'm going to provide some resources that you can go to if you want to get some more information on some certain topics within the video. So what exactly is tuberculosis? Well, tuberculosis is a bacteria that enters your body and affects your lungs. When tuberculosis becomes active and multiplies within the body, the immune system can't stop it from growing, so then it multiplies, and that's what leads to the tuberculosis disease that develops the symptoms that you get with it. So who is at risk for tuberculosis? Well, anybody that has been around somebody that has tuberculosis is at risk, which would be, the nurses and doctors that care for the patients that have tuberculosis or family members that are around these people. Those that come from a country where tuberculosis is common and is not contained like it is here in the United States, they're at risk. Those that have conditions that weaken their immune system or make them immunocompromised, long-term care facilities, the patients that are in those are at risk. The correction facilities, so those in the jail population, those are at great risk because of how close they live, with one another. And if someone has it, it's very easily spread and then becomes a rapid spread within the jail population. Also those in homeless shelters, and infants, children, and adolescents who are exposed to adults that have it are at risk for latent tuberculosis infection or TB. So some symptoms that you might have if you have tuberculosis are chest pain or pain when you breathe in or cough, a cough that lasts 3 weeks or longer. If you're coughing up blood, you have unintentional weight loss, or you're just tired, you have fever, chills, and night sweats. Those are some other symptoms of tuberculosis. Okay, so some ways that you cannot spread tuberculosis are if you shake someone's hand, if you share food or drinks with somebody that has it, if you touch their bed linens, if you touch the toilet seat, or you share toothbrushes, which is also a little gross. Not a lot of people do this, but some do. But these are not ways that you spread tuberculosis. This is only an airborne disease that is spread through coughing close to somebody, and then that person inhales those, bacteria particles that are floating around. So if you come in contact with somebody that has it, or you have been infected, and you think you've been infected, you should be tested right away. Catching it early can prevent those worsening of symptoms that you saw on the previous slide of coughing up blood or more severe symptoms. So get tested. There are medications that can prevent you from getting sick. So if you think you were exposed and the person has it, get to your doctor right away. Even if your first test is negative, you could still carry the bacteria in your body, so you should be tested again in 12 weeks just to be sure that you don't have it. So those in the jail are at higher risk. 4 to 6% of TB cases in the United States occur among those that are in jail at the time that they are diagnosed. Prisons are an ideal place to transmit TB since the population, like I said before, is in such a close contact with one another. And transmission is by very small aerosol droplets are very easily transmitted. Other risk factors in the jail population are at a higher rate of being in poor health, poor nutrition. A lot of them are addicted to drugs, and then they have the presence of other conditions that put them at risk. And jails are generally overpopulated, and they have poor ventilation, so not being able to get those TB aerosols, out of the jail very easily is another reason why they just hang around, and then it just spreads even worse. And there's a lack of screening in the jail that makes it, like a breeding ground for the TB. So this is another reason why this population is at such a higher risk. And, hopefully in the future there's ways to make this not as prevalent as it is. Another population that I focus on were children and why they're at higher risk. So those that live in a house with somebody that has active tuberculosis are at a higher risk of catching it. Kids don't have as developed lung systems as adults, so if they get it might be harder for them to fight it off like an adult would. So I think that puts them at a higher risk. Children that have been infected with HIV or other conditions that weakens their immune system puts them at an even higher risk. Children that are born in countries that have a high prevalence of TB are at risk, and children that visit countries with TB put them at risk. Those in communities that generally receive inadequate medical care, so like if they're in the homeless population, or they just have very poor health overall, with their parents and stuff, so that puts them at risk. And then those that are, the children that are born into jail, that puts them at a higher risk as well. And then this just kind of points out some other populations that are at risk. Those that are homeless, those that travel internationally, the African American community, the Asian community, and those who are pregnant are also other populations that are at risk for catching TB. So how do you prevent getting tuberculosis? So if you just cover your mouth with a tissue when you cough or sneeze. It's always kind of the rule when you cough, you cover it, cough into your elbow, cover it with, like a tissue, your hands, wash your hands often. I don't think enough people do this, maybe more so now with COVID-19 going around, but in general, I don't think people wash their hands enough. So wash. Don't visit other countries. Don't visit others that are sick, that are sick, or don't invite them over. What I was saying before, don't visit countries that, have a high prevalence of tuberculosis. That's another way to avoid catching it. Take all your medication until it's gone if you have tuberculosis. So you may become sick again if you don't take all of your medications, and you risk spreading this to others. And always keep all of your doctor's appointments and follow-ups. So diagnosing tuberculosis is done through a skin test or a blood test. If somebody is positive, they will also have a chest x-ray, and then a sample of their sputum might be taken as well. The current treatment, there's drugs that fight the TB infection, and like I said before, these should be taken all the way through and don't stop, just like antibiotics. And here's a list of the drugs that you can use, that they use. There are many different kinds out there, so depending on what you're allergic to or what you can tolerate, those are the ones that you will be taking. And like I said in the beginning, here are some resources that you can visit. The CDC website has a ton of information on tuberculosis and the populations that are at risk, treatment, diagnosis, everything. It's a great website. I also provided some resources for the childhood population that is at risk, and then those in the jail population that are at risk as well. If you want to take a minute to take the post test, and then there's some answers as well. And thanks for watching my video. I hope you enjoyed.